In your time with Measure Evaluation, what gains have you observed in M&E capacity building for public health programs?
Oh, I think M&E capacity has evolved tremendously. When I started in the M&E field, even before being director, there were very few organised M&E units in national programmes or even in non-governmental organisations, and there were very few professionals with M&E skills. That has totally changed, and I think there's a whole professional field opened up in monitoring and evaluation for public health programs. Many countries at least have now national M&E units that are staffed with more than one person, and that's also reflected in better availability of data, particularly for HIV, but in other sectors as well.
How have capacity building partnerships with training institutions evolved during your tenure at Measure Evaluation?
Well, when I became the director of Measure Evaluation, which was at the end of phase one, we were working with regional training partners, but project staff was still doing a lot of the training themselves. And we did involve the training partners staff as well, but a lot of the training was being done by the partners, by us, our own staff. We made a decision at the beginning of phase two to make transitioning to regional training partners offering the trainings independently an explicit goal of our capacity building strategy, and that required significant leadership and commitment from the individual institutions that we were working with, and we're very grateful for them for that commitment. Another change I would say is that there's been a reduction in the provision of scholarships for the masters and for the short-term workshops. We're going to kind of move away from that. I believe that the scholarships are very important, both for the increasing access to the training for the individual participants, particularly from small NGOs and government agencies that might not have training funds, but also I think they're important for reinforcing that institutional commitment to these programs. But at the same time, they're hard to sustain, and I think in the long run, it's in everybody's interest to diversify the funding base for M&E training.
What gains have been made in terms of building the capacity of individuals and institutions to monitor and evaluate public health programs?
I think what we really see is that the data and the wider evidence base we now have on global health has advanced considerably thanks to the efforts that have been made to build both the individual and institutional capacity in M&E. At the global level, you can probably see this most clearly in the data on the Millennium Development Goals or that are provided on HIV through the UNGAS reporting system. But I think gains have also been made at the country level in informing health sector reviews, for example, or in developing national health strategies and plans which can now have more evidence on which to base those plans and reviews. I think even at the NGO level, at smaller organisational levels, the data quality and use has improved, although there's still a long way to go, of course, but I really think there has been tremendous progress made.